Good day, Doc. This is our case report about mini-implant placement following extraction of mandibular central incisors due to caries. The history of incorporating implants into dental practice goes way back to 600 AD when evidence traces back to the use of cat shield species of the replacement of mandibular teeth. Nowadays, we have incorporated better methods of doing implants. Originally, when dental implants were discovered, they were all the same size and shape. Unlike modern implants, they come all manner of shapes, sizes, and even shades. Dental implants have provided the profession and the patient with a more effective method of tooth replacement. Partial and complete edentulous patients have the better option of tooth replacement. Tooth number 41 has been extracted because of a deep caries lesion that was deemed unrestorable. This case seems to be simple, but the bone width of the anterior region of the mandible presents a much tighter space of implant placement in other region. The patient also exhibits crowding in the anterior teeth, which makes it quite challenging to place an implant in this region. The surgeon has to take into consideration of all this fabricating the treatment plan.
Chief complaint. A 48-year-old female patient came to the clinic 5 months after having her tooth number 41 extracted in the hopes of having her missing tooth replaced. She said, "I feel shy smiling because of my missing tooth, and I feel it will get worse if I don't do something about it."
The medical and dental history also of the patient was taken, and upon her interview for her medical history, she says that she doesn't have any illness at present. She has no allergies to any drugs, and she doesn't take any medications as of the moment. And also her dental history, her last visit to the dentist was during the extraction of her lower anterior incisors. Next, we have the clinical examination of the patient, and upon doing so, it was observed that there are no active caries lesions present on the other tooth, and gingival health was also present. There's no signs of inflammation on the edentulous gingiva. However, during the radiographic exam, it was observed that there is bone loss on the mesial root surfaces of the adjacent tooth of the edentulous areas, which may also be the subsequent cause for the gingival recession on these areas. Now, prior to the insertion of the implant fixture to the patient, there is a custom fabricated surgical stent that was provided to the patient. This is for the guiding of the proper angulation and proper alignment of the implant during the surgical procedure that's going to be done to the patient.
The procedure was done on the 4th day of September, year 2006. An envelope flap was made at the crest of the bone, and the pre-made surgical stent was placed to guide the preparation of the implant site. Site of penetration was marked using a surgical round burr and was followed by establishing the depth and alignment using a 1 mm twist drill. A guide pin was placed to check and verify angulation. To establish the final diameter, a final twist drill of 2 mm was inserted into the site and final seating of the implant was done. The images show the implant fixture is seated in the edentulous space in lingual and facial view respectively. The flaps were sutured over two sides of the abutment. A post-operative radiograph was taken to evaluate the seating of the implant, and a provisional crown restoration was fabricated and was seated using zinc oxide eugenol cement placed out of occlusion from the upper teeth.
In this picture, it shows the post-operative image of the implant site with cemented acrylic temporary crown and sutures on interdental gingiva. The patient was recalled after 1 week for the removal of the suture. It can be observed that the wound was healing nicely and there are no other complications on the wound. The patient was instructed to maintain good oral hygiene and to avoid biting hard food over the implant site. The patient was then scheduled to come back after 4 to 6 months. After 5.5 months, the periodontal area looks well adapted and healed. However, there is plaque built up at lingual surface of mandibular teeth, but there are no damaging signs of inflammation. A temporary crown is removed in preparation for the impression taking for the final construction of the porcelain fused to metal crown for tooth number 41.
Healing of bone normally takes around 4 to 6 months post-operatively. Stabilization is key to the healing of the implant in its early phase of healing. Any unnecessary movement in the bone implant interface would incidentally disrupt the healing and osseointegration. A long and wide diameter implant would give the best prognosis for the procedure. This is why, since the patient is having a mini implant with a narrower than usual diameter, it is empirical to allow proper stabilization of the implant, hence placing it in hypoocclusion. In retrospective study conducted by Vigolo and others, where they discussed the probability of success in placing small diameter implants, it is stated that 94.2% of the 44 patients who had a mini implant restoration had a successful treatment. They concluded that mini implants can be a successful treatment of choice for the restoration of function and aesthetics. This is the radiograph taken after a week following the insertion of PFM crown final restoration. The patient came back after 5.5 months, and upon inspection, the bone implant interface is prudent and the restoration is going well.
In conclusion, mini implants can be used not only in single tooth restorations, but also in orthodontic procedures, anchorages for implant-retained partial denture prosthesis and other applications. In relation to the previous studies and controversies regarding to the success of the mini implants, this case shows that it is an efficient method of restoring teeth in terms of both functionality and the patient aesthetic requirements, as well as space-limited areas where a conventional implant is contraindicated. There is still so much to be discovered about the long-term fate of the utilization of mini implants, but studies are present to deliver a positive outcome.